Hi, my name is Joshua Freitas with the National Institute for Dementia Education, and today we're here to welcome Shari Flight, which we're going to talk about different options we can do with dementia care versus it just being the traditional or what we think that we should be doing. There's other options out there. To jump in, Shari, would you mind introducing us, tell us a little bit about what you do and what brings you to the field?
Yeah, of course. So, Shari Flight, like you said, and I own a dementia consulting company. We are based out of Massachusetts, Plymouth, and I own it alongside Katie Fournier. She is an LPN, and she and I met in the memory care world in the same industry. We were working in the same facility, and we both just recognized the need for the caregiver to be assisted as well along with that dementia journey, because we're noticing that the person with dementia is being cared for, but not necessarily the caregiver. And we also noticed trying to focus on the holistic approach. So we have the knowledge that they're eventually going to need some type of support with medication, but trying to see what we can do with our approach as the caregiver, but also some other holistic approaches as well.
I love that. And a term that always comes to mind for me is non-pharmacological intervention. And I would love to hear from you, what is a success story, maybe a case study or something that you guys have noticed is that holistic approach, kind of walking us through that. What does it look like, and maybe a success story that you've had?
Yeah, so we actually played around with our own case study in the building that we were in when we realized that we had this interest. So Katie is now a Reiki master. At the time, she had her, I think, Reiki 2 certification. And we had a bunch of people with anxiety, with the behaviors that come along with dementia, like agitation and whatnot. And we wanted to see what we could do to incorporate that, but also incorporate blue light therapy, which we did some research on, and some aromatherapy too. So we took all of our residents and the ones that had those PRN medications, those as needed medications, we were introducing Reiki as needed. We were introducing aromatherapy in the evening before bed with some lavender, and also the blue light therapy. So we did half of them half of the month, and then half of them the other half of the month. And every time, or both sides of it rather, anyone that had that Reiki and that aromatherapy, the anxiety went down, the depression went down, the behaviors went down. They didn't need the PRN medication. And then when we flipped it, those people needed those PRN medications again versus not needing them. So it was really cool to see.
That is cool. I have to ask, what was the aroma, or is there anything in particular, or kind of a set of prescriptions, or is it one smell that you noticed that was the most impactful?
Lavender. And I think that's one that most people are familiar with. It's just very calming and soothing. It can assist with decreasing that agitation, the anxiety. So we were setting it up in their rooms before dinner time. So by the time they were done with dinner and getting ready for bed, it was already starting in their room. And they would come back to go to bed later in the evening, and the room smelled like lavender and the blue lights were already on and ready for them.
So it's really fascinating you bring up blue lights, and I know that we have some literature and research where we've researched red lights, and the certain frequency of red lights can foster melatonin production, but not as much as looking at like anxiety or depression. It seems like that's where your lights go. Can you tell us a little bit more about that and kind of the color of lighting too?
Yeah, so the blue lights that we use versus the red light therapy, with the red light therapy typically being applied. The blue light therapy, we literally bought a lamp for the patients that we had, and we just put the blue light in the lamp, and it's in the environment, and it's a calming effect. It has a soothing calming effect for the person with dementia, everybody truthfully, but a calming effect for them. So it can assist with kind of decreasing agitation, stress, anxiety, and it can help with boosting some of the good feelings that we get versus having some of those negative feelings that come along with having dementia.
That's fascinating. So the blue light itself creates kind of like a tranquil feel to relax the person, and then with the smells too as well. What are some other tips? You got me going, because I think somatically we could treat a lot of symptoms of dementia, but what other tips kind of come to mind that you wish more people would consider?
I think the big thing is realizing, first of all behaviors have a reason for why they're starting. There's always a trigger. So trying to figure out that trigger, oftentimes it's recognizing that it's the caregiver. Sometimes it's if we're approaching too abruptly, if we are not going at their pace. So realizing that before we need to assume that they're having a behavior or assuming that they need a medication, what can we do to figure out how to change the environment? How can we figure out how we can change our approach, and what other steps can we take to be able to assist with that?
And what does that process look like? So I know that for me, being in memory care so long, we see a behavior, we don't always think about what it's communicating, and a drug is prescribed. But for you, what does that process look like from the holistic approach? How do you approach that situation? Who's involved, and kind of what conversations go around that?
Yeah, so if it's someone that's living in the home, we try to introduce something called a behavior log that we've created, and I know some communities do use them too, where we'll have the family start tracking the behavior before we even start with anything. So ask them, what was the behavior? What happened right before it? Were they watching the news? Is it something that you said? Was it a certain song that came on? So we can figure out a possible trigger. And then we have them also start taking note of what worked. How did you respond? Did it work? Did it not work? So we can see what is the possible trigger, what is the actual behavior, and what did or did not work after. So then we can move forward with that to say, okay, this is what we're going to suggest for approach from you, or maybe removing the TV, or on the other side of it, work on responding versus reacting to that behavior too. And then that's where we would go into talking about the benefits of meditation, Reiki, and all of that too, to see if that can assist.
I have to ask you a question is how many of these practices do you put in your own kind of life with meditation or managing those things through or different lighting or smells? How much of them do you use as you're recommending them? Are you using them yourself and how often?
I am, not as much since having kids because they take up all of my time. I try to meditate when I can, and same thing with aromatherapy. I have a aromatherapy and a diffuser in my kitchen, so I try to turn that on as well. And the lavender is usually the one that I go to also.
Now, I think it takes a whole village. Can you kind of walk us through who should have a seat at the table when navigating this and what you guys seeing as that non-pharmacological holistic approach? Who has a seat at the table to really navigate it? Do you include the person with dementia, their family? What does that look like?
So I think from the very start of that diagnosis, that's where you build your team, whether it's family, whether it's friends, whether it's reaching out to agencies like us and other companies. I think you need to build that team of people so you have support for yourself as the caregiver, but also for this person too, as they progress. And I think just making sure professional-wise that you have someone that has the knowledge of dementia and the progression so you can properly plan. So you know what the home care agencies are in the area, you know what the memory cares are if you need to get to that point of moving them. We always promote touring before you even need it, especially if the person is early on in their dementia process. That way they can be a part of it. And then to that point too, I always say have conversations with the person with dementia when they are early on in that progression. So if they're able to understand that they have that diagnosis, let them be a part of that. Let them tell you what their wishes are, especially when it comes down to, I know from state to state it's a different name, but that DNR form, it's called a MOST in Massachusetts. Get all of their wishes up front. So that way you don't have to make those hard decisions towards the end stages of dementia and wonder if you're making that right decision too.
What I love is that I feel that being intentional and what you're hitting on is having a plan and a team that you're selecting now. Oftentimes I see people, they get into a pinch and they're like, what are we doing? How do we do this? But finding a better solution before you get there can definitely ease that stress too as well. What are some things that you're seeing in communities or at home that you think people are overlooking that your services could help provide some insight that gets overlooked? Or maybe the top one or two things that you feel that people should reach out to you earlier than letting it kind of linger?
I think, again, just the planning, so we can assist with that. If someone doesn't have a healthcare proxy yet, if they don't have that DNR form yet, we can help with that. They don't have to do the research. So when they work with someone like us, if they want home care, or if they do want an assisted living, we can do all of that research. We just get their wishes from them first, and then we can do all the legwork. We can set up the tours. We can join them for the tours if they want to, and just guide them through that entire journey. And oftentimes people, like you said, they're not doing that. It's, Mom fell, she's in the hospital, and we urgently need to get her somewhere. So it's usually, unfortunately, a spur-of-the-moment decision instead of taking the time to plan and to make sure that you can have all your pieces together and ready to go.
And I have to say that there's so many different types of dementias. We know there's over 100 different types. How does that change how you approach this? I know we want to talk about personality, the stage that they're in, but there's also different types of dementia. So how do you approach that to meet that person where they are?
Yeah, so we always start with our complimentary phone call, and in that phone call, we try to ask if they know what type of dementia, because unfortunately, we see oftentimes that someone is diagnosed with just dementia, which is simply just the symptoms. That's not going to tell you too much about that journey. But if they can either ask their primary care physician to refer them to a neurologist, or if they already have one, speak to the neurologist and push to see if they can get a specific type of dementia, whether it's Lewy body, frontal temporal, whatever it may be, that will help us to support them, because because although there's similar symptoms, there's of course very different symptoms as well. And for some of them, that progression looks a little bit different, whether it's a quick progression or a slower progression. So the more they know about the diagnosis, the easier will make it for us to assist them. And oftentimes when they tell us what's going on, we can tell them that it sounds like a certain type of dementia, but of course they need to get further assistance from that doctor.
And what is a theme that you see with caregivers kind of as the biggest struggle for them as you're helping support them? What are the things that surface the most? Is it wandering, keeping them home safe? What is the important pieces to that you're hearing as a theme?
I'm surprised it's not wandering as much. That's usually like the red flag. It's time for us to look. But honestly, I would say it's the repetitive questions. Families are having a really hard time grasping and understanding that they can't help it. It's the first time they're asking that question or telling that story every single time. So trying to get them to understand that, but then also trying to get them to understand and navigate the different behaviors that can come with it and how to respond. Because it's very common that we're going to want to react to a behavior, and when we react, that's actually going to make the behavior worse. So trying to teach them about responding to the behavior and just guiding them through that instead. And it really goes a long way when we're able to assist with that portion of it too.
In the industry, there's always things that I feel like us that work in the industry as practitioners want to change. Is what is something that if you could just wave your wand tomorrow, what is one thing that you wish would just change and make it easier for everybody, whether it's more education, resources? What would you change in the industry if you had a magic wand?
I would definitely say the education. I think that a lot of education in facilities is outdated. A lot of people are still just hopping on a screen and watching a video or going through an online training, and you can learn stuff from it, but oftentimes people are not fully engaged, or they're just clicking through to the next slide waiting for that test to take the test. And I think there's just so much to be said about that in-person interaction. We try to make all of our presentations personally, we try to make all of them interactive, so the staff has to participate, and we get a lot of really good feedback for that. So I really think education is something that needs to be looked at a little bit more.
Tell me about how you approach education. What does that look like? So if somebody had a training with you, what is the important pieces of that for people to embody the knowledge? What kind of process do you kind of walk through or work through with that?
Yes, we have like 20 different presentations all related to dementia, whether it's focusing on just the behaviors. And with that one in particular, we try to ask the communities first, do you have any specific examples you want us to build into it? So that way we can tailor it to what they may be struggling with some residents right now. But I think just our biggest goal and the thing that makes us different with it is trying to involve them. So we ask for wheelchairs for some of our training so the staff can sit in the wheelchairs and have to approach each other that way. Just trying to make it as up to date and as engaging and as fun as possible. It just seems like it assists quite a bit.
What is one thing that you wish that physicians would really latch on to when it comes to holistic and non-pharmacological approaches? What is one thing that you wish that they would start to prescribe?
I would love, this would be like my picture perfect world, where they would recognize, as we do, that with the brain changing, sometimes medications are the only thing that is going to work. But I would love it if they would be more open to introducing someone like us to say, before we look at this medication, I want you to reach out to this company. They do have some holistic offerings that they can provide to see if this supports the behaviors that you're suggesting they're having. And then if that doesn't work, then come back to us and then we can talk about the next round of medication.
So kind of taking the holistic approach, let's try holistic first, then medicine second, unless it's necessary at that time. And it sounds like it's not a difficult thing to do. I love lifestyle medicine, but really what you're doing is creating a lifestyle for the caregiver and the person with dementia to embrace these non-pharmacological interventions like the aromatherapy or lights and different things that can make an impact. What other advice would you give to anybody listening that right now is your chance to get some information out there? Is what advice would you give to people?
I think just constantly educate yourself. We can find anything we want online. I also think go to your local council on aging. They are a wealth of knowledge. They have done a lot of the research for you too. So if you need to find some local resources, you can do that as well. They usually have everything. And then I think just for the caregivers, focus on caring for yourself just as much as you are for the person with dementia. I know it's easier said than done sometimes. And we've all heard the different sayings of it's just really hard to take care of yourself. But trying to make sure that you are practicing what you preach and that you are also even if it's 5 minutes to yourself, an extra long hot shower, whatever you need to do. But focusing on all of that and doing all the research up front, it's just so important.
Fantastic. And if somebody wanted to get in touch with you or to learn more or ask questions, what's the best way for them to get in touch with you?
Yeah, so they could email us. It's info@emberholistic.com, or they could call or text us. It is 617-921-1753.
Thank you so much for coming on today, and thank you for all of our listeners. Please subscribe and share this information. The one way that we can make a difference is if we take the information we're learning and sharing it with other people. So once again, my name is Joshua Freitas with the National Institute for Dementia Education, and I want to say thank you for watching.